If you've recently had hip replacement surgery or are planning to have one soon, then this video is especially going to be helpful as I'm going to share 21 tips that I give to all my patients after having hip replacement surgery. Tip number 1, use cushions or thick blankets to elevate the height of chairs. So after surgery, trying to stand up from a low sitting position is going to be very challenging. So the higher you can get the height of the chair from the ground, the easier it's going to be. So using a thick cushion or thick blanket on top of a couch, sofa, or chair, whatever you're going to be sitting on, is going to make it a lot easier for you to stand up. Tip number 2, when trying to do bed mobility, so going on and off the bed, it's going to be difficult to lift up your surgical leg. So using a belt or a strap and hooking that around the foot and ankle of that surgical side is going to make it easier for you to transition and lift the leg over. In some cases, you can use your non-surgical side to help lift up your surgical leg. So you'd just be placing the foot of the non-surgical leg underneath the foot of the surgical leg to help lift that leg. But in general, using a belt or strap to move your surgical side is going to be much easier. Number 3 is do your ankle pumps throughout the day. This is an exercise that cannot be overdone. It's not going to cause more soreness at your hip. So whenever you think about doing ankle pumps, just do them throughout the whole day, 10 to 20 at a time, as they're going to help really improve your circulation to reduce the swelling. Number 4 is icing in multiple places. So don't just ice directly on the incision. Typically the ice packs that you use are going to be larger in size, so they're going to cover a big surface area, but you might have swelling and a little bit of inflammation above and below that area. So icing your thigh, icing above the hip, and on the front and back of the hip are going to be very helpful. Tip number 5, don't miss a day of exercise. So especially in the first 1 to 2 weeks, you want to be working on some of the exercises every single day. So if you're not able to hit your target numbers, that's fine, but you definitely don't want to just do no exercise at all just because you're having pain. Tip number 6, related to tip number 5, is just because we have our target numbers for the reps and sets, when you're doing your exercises, if you're having some discomfort or a lot of fatigue, then just break up the amount of reps, the amount of sets, and take a longer period of a rest break before doing the next exercise. Number 7, try to avoid being in one position during the day longer than 1 to 2 hours. So you want to get up and change your position. So if you stay in one position too long during the day, you can increase your swelling and also joint stiffness. Tip number 8, very simple, keep your leg elevated above the level of your heart. That's just going to help with the swelling and improve your circulation. Tip number 9, if you live in a multi-story home, if possible, try to sleep on the first floor during that first 1 to 2 weeks just to reduce how often you're going up and down the stairs. Tip number 10, if you have to use the stairs, try to hold on to both railings. If the staircase is too wide, then have a cane in one hand and then the other hand is going to be holding onto the railing. Number 11 is specifically how to use the stairs when you're going up and down. So in general, if you're going up the stairs, you want to lead or step with the non-surgical leg to go up. And then when you're going down the stairs, you want to step first with the surgical leg. So one way to remember this is up with the good, down with the bad. So you're stepping first with your good leg or non-surgical leg, and you're going down with the bad leg or the surgical leg. Tip number 12, use a grabber to pick up light objects on the floor. So in the first 2 weeks, you want to limit how often you're bending down and trying to pick things up from the floor level. So using a grabber is a great way to avoid this bending position. Tip number 13, when you're doing your standing exercises, when you're cleared by your physical therapist to do specific standing work, use your upper body, so your hands on the walker or on the countertop, as much as needed in the early stages. So you want to make sure that your hip can tolerate that amount of weight bearing it's feeling. So if it's too painful or it's not stable enough, feel free to use as much upper body at first as needed. Tip number 14, so you're going to be icing a lot throughout the day and even at nighttime. So make sure that there's always some sort of layer between your skin and the ice. Never have the ice directly on your skin. Number 15, since you're going to be icing so much throughout the day and night, when you're changing out ice packs, so once one pack gets too warm and loses its cold and you're about to switch to another one, just let your skin have a little bit of a break, so 10 to 15 minutes before you put on the next ice pack. Tip number 16, and this is especially important because you're going to have to focus on doing all your exercises as much as you can. So stay on top of your medication, your prescription medication schedule before you have your physical therapy appointment. So sometimes patients will miss their taking their pain medication or anti-inflammatory medications before their PT session, and they have too much pain, and especially as they start to try to do some of the exercises, they're going to be already in pain and inflamed. So they're going to be limited in terms of how much work, walking, exercise that they can tolerate during the session. So as long as you stay on top of your medication schedule, you'll be able to tolerate and do more when you're working with your physical therapist. Tip number 17, when you're walking with your walker, try not to look directly down at your feet. Try to look like 6 feet ahead of you, so you're not straight up, but you're still looking in front of the direction you're walking, so you can keep an eye on any obstacles that are in the way, so rugs or small objects that could be any type of like tripping hazard. So you're still aware of your environment, but you're avoiding those bad habits of being really bent forward and not having proper posture when you're walking. So make sure that you're not looking straight down at your feet when you're walking. Tip number 18, and this is especially important to make sure that you stay as pain-free or as minimal pain as possible, and that is to memorize the post-op precautions. So your surgeon and their surgical team will typically educate you on what positions and movements they want you to specifically avoid. Your PT will also discuss this with you just to make sure that you have it memorized. But the more you can abide by these post-op precautions, these positions and movements that you need to avoid, the better off you're going to be in terms of your pain. Tip number 19, don't rush to a cane too soon. So oftentimes I'll see patients who've been using their walker for the first couple of days, and they'll say it's very clunky, it gets in the way, and they want to just jump straight to their cane. And even though they can walk stable with a cane and not need the walker, that doesn't mean that that doesn't mean that the actual hip is ready for that much weight bearing on that surgical hip. So use that walker as much as your physical therapist, as much as your surgeon kind of recommended you to. So that first 1 to 2 weeks, you still want to be using that walker just to take some of the weight bearing and the pressure off of the hip until you're able to demonstrate that you're not walking with a limp and that the strength of the muscles around your hip and around the knee are strong enough to where you're walking close to normal and you don't need as much weight-bearing assistance from the walker, and you can transition to the cane. But until that occurs, don't rush to the cane too soon. Tip number 20, and this is a difficult one to do, is keep your legs elevated while you sleep. That's just going to help with the circulation and improve the swelling. And lastly, tip number 21, understand that everyone heals at different rates. So don't worry about comparing yourself to another patient or another friend who had the same joint replacement. Everyone's body heals at different rates and for multiple factors. All you should worry about is just the things that you can control. So your icing, doing the exercises, making sure you're avoiding the movements and positions that you're supposed to avoid, staying on top of your pain medications. All these things will help you recover the fastest. So as long as you're doing what you need to do, your body will heal and take care of itself. So if you found that video helpful, please subscribe, and I'll see you in the next video.